All right, we are 2 minutes after the hour, and most of us seem to be here. I'm just going to check that our speakers, yes, Erin Ferencik is here. So I think, Katie, if you're good, we are ready to go.
Hey, everybody. Welcome to this week's GFAN call. It's good to have some new faces to join our familiar faces. So welcome, welcome. I'm Katie from Global Fund Advocates Network, and just a few sort of really quick reminders as some of you are joining that we do record these calls and post them up on our website, along with any resources that we have from the calls, so that we are able to share them with colleagues after the fact. We also provide French interpretation, so you should be able to find through the interpretation button along the bottom of the Zoom screen. You should be able to find the channel for either French interpretation alone or floor sound. So please go ahead and utilize that. Just double checking to see that we are recording. Yes. Okay. Sorry. It didn't interrupt me when I said that. This is usually the case. So I just wanted to make sure. So today we have an agenda just to, for some of you who were on our sort of exceptional call last week. We do have a quick sort of review and update around Grant Cycle 8 or GC8 and what is going on there. We also have colleagues who joined us from United for Global Mental Health who are speaking to us today about some of their work around funding comorbidities. I believe it was done in concert with UNAIDS, but I might be still a little too sleepy this morning to get that correct, and I'm sure will be corrected by our colleagues. And then we also wanted to come back quickly around some of the work that you've seen GFAN doing to gather information around the US government memorandums of understanding. And so providing you all with a little bit of an update on some of the early sort of things that we're hearing from you all around some of that work and some of the updates of how to engage and find out more about that work. So that's our agenda for today, hopefully with lots of time built in through for discussion and for Q&A. So if we can just move along to the next slide. Again, some of this we covered last week in that exceptional call, but for those of you who may not have been able to join us or haven't heard, the allocation letters were sent out on March 16th, which provide the information to countries about the total amount of funding that's available and for which components they're available for, as well as the co-financing requirements that countries will have to meet in order to leverage the full amount of the Global Fund funding. And as Conte has just put in the chat, there is a group of colleagues who are, sorry, not GFAN, but a group of partners who are collecting allocation letters and sharing a really, really helpful breakdown of them. So you can see that link in the chat if you don't already have it. And if you do see or are able to share allocation letters that are still outstanding in that effort, there's a way to get them to those colleagues. So please do sort of share. Also, just to say that the core guidance documents are still not available from the Global Fund, even though there are a number of resources related to the grant cycle that are up on the Global Fund website. The core guidance documents are still not available. And just a quick reminder on those timelines there in terms of the windows. So countries will have been given a certain amount of time once they receive their allocation letters to then notify the Global Fund as to which window, which of those dates they're aiming to have their applications in for. Last time around, I think those of you who have followed closely will know that the majority of those applications came in the first date. And as you know, the second date was also significant. And then there was sort of a smaller amount that was planned for that third window. There might have even, no, I think there was still only 3 last time, although there might have been 4. But this time, I think it's a bit of a guess as to whether or not countries will, like where the majority of applications will come. So we shall see. We will wait to see yes, that's the Global Advocacy Data Hub that's collecting those allocation letters. So if we can just go to the next slide, just to say, I think everybody's aware of sort of what's at stake in this cycle in terms of the allocations being smaller than they were in the last cycle, both because of the replenishment amount and also because of the secondary sort of impact of C19 RM funding actually being finished and not available. So there's quite a bit of a drop for many countries, and also some of the drops are indicative of sort of the accelerated transition that's going to be taking place over this grant cycle and the next grant cycle. We do know that about 28 of those 63 grants will be transitioning at the end of grant cycle 8. So in the next 3-year implementation cycle will be the final one. And just on the next slide, just to say that we're really looking for those core guidance documents from the Global Fund, which will help us understand, what is intended and what is meant by integration in the Global Fund current context, and what they will be as tools to protect civil society, and so on. And on the next slide, I think, and we'll share the link directly in the chat, that we are gathering a repository of resources that have been developed by partners, and you can check that out on our website. And please, if you're aware of any other resources that could help colleagues, please don't hesitate to reach out to us and flag them for us. It's always helpful, although we do have a keen team that's always got their eyes on a number of different spaces. There may be things that we will miss, but we are happy to sort of house those resources. And as the need becomes clearer and we see when some of the allocation windows that countries are intending to meet are, we will be developing some tools that will support advocacy for colleagues and house them there as well. So that's my quick sort of overview for those. It may not have been quick enough, but hopefully it was. So I would just ask if there are any sort of quick sort of questions or sort of remarks that colleagues want to add. I'm just going to open the chat so that I can see if there's anything that colleagues have raised there. And just if you can use the raise hand to let us know if there are any quick questions or clarifications that colleagues wanted to either offer because of information that you have, or wanted to ask to see if anybody else knows. Now is the time for that. I'm struggling with Zoom this morning. Oh, there we go. Okay. So just noting that offer of some new tools, Erin, thank you. And kind of noting that some countries are yet to be informed if they will get matching funds that will be additional to total allocation. Am I understanding that correctly? I don't know.
No, so the matching funds countries would be notified as
Yes.
part of the allocation letters.
I just missed saying that.
Yeah.
Is that correct?
No, yeah.
Okay, but it is, yeah, okay, good. But it is in that really helpful spreadsheet that we've shared, that colleagues from the Global Data Advocacy Hub are pulling together, or the Global Advocacy Data Hub, sorry, apologies. And so that information is also in there. So thank you for that clarification, Kana. Okay, and not seeing a few other resources being added, which is excellent, and thank you so much, but not seeing any hands raised for an intervention, then thank you, everyone. Please do continue to share those resources, and we will continue to come back to this on our regular calls so that we have an opportunity to share what may be the latest. And of course, when we see things like the guidance documents from the Global Fund coming up, we'll be making sure to sort of highlight that for everyone. So we're going to move on to the next component of our agenda, which is a presentation from colleagues from United for Global Mental Health around the report with UNAIDS on funding for co-morbidities in Global Fund grants. And so I believe they do have a presentation maybe that they will be sharing directly. So I will pass it over to Erin Frenchik. So Erin, welcome very much to the GFAN call, and over to you to share sort of those lessons that you're sharing in those reports and some of the data point and arguments that you have that could strengthen the case for better integration, despite the funding cuts that we all know that we're dealing with. So Erin, over to you. And then we will open it up for Q&A following your presentation. And that is an adorable picture on your desktop. And this is also lovely. Very nice cover page, but over to you, Erin. Thank you.
Well, thank you. And if only they were still that small. Now they're 13 and 7, so, different landscape.
Indeed.
Ah.
Thank you.
Well, thank you so much for having me today. I'm Erin Ferencik from United for Global Mental Health. But in a former life, I was actually with the Global Fund. So I spent many years with the RSSH team. I was actually the technical advisor for primary health care. If you believe it or not, they had a technical advisor for primary health care, and I was embedded within the RSSH team. So I've got a lot to say actually about integration. But today I have the pleasure of sharing with you a fantastic review and mapping exercise that we supported along with our colleagues at UNAIDS. It was funded through Grand Challenges Canada. So thank you, Canada, for stepping up and really supporting this work. And I'll be sharing lessons from this review, which was about GC7, and really thinking about how can we take lessons from GC7 and apply them to GC8, particularly in this constrained funding environment. So the review looked at priority comorbidity investments in grant cycle 7, really with an eye to improving the health and well-being of people living with or at risk of HIV and or TB. And I don't need to tell this group this, but I will underscore why does this matter now? Well, as we all know, in this complex world, we have overlapping health needs that really require a comprehensive and continuous integrated approach to deliver truly person-centered care. And I underline the truly person-centered care. But what will it take to achieve that, right? GC8 is happening in a ever more restricted environment, this tightening global financing. We have increased pressure now on countries to show efficiency, value for money, measurable impact. And this translates into hard prioritization. And that's what the country dialogue and by extension, the funding request process will really be about. How do we make these prioritized decisions? To help us make these decisions, let's just pause and take a look at, well, what are countries already telling us? And what we know from this review is of the 103 approved grant applications, which we reviewed, 97% actually included at least one priority comorbidity. And what do I mean by priority comorbidity? That included a cohort of NCDs, and I'll unpack that a little bit more in a second. It included cancers, specifically cervical and anorectal cancer. It included mental health conditions and substance use disorders. Countries requested $554.7 million to address these comorbidities. Right? That's not insignificant. I would argue that that's pretty remarkable. And then if you look at the breakdown of what countries were requesting, about 46.5% were in that NCD bucket, then followed by substance use, followed by cancer, and subsequently mental health. So what's the take-home message here? Well, the way I read this is the demand is quite clear and widespread. So countries in GC7 were telling us, hey, we need to be paying attention to comorbidities. But there's always a but, right? But the reality that we saw in this review was there's a significant funding gap. So while the demand was high, only 11% of those requests were actually in the core allocation. The remainder, that 89%, sat in the PAR. So meaning they were recognized as important, but only if additional funding could become available. I mean, this is GFAN, so you all know how the PAR works. So 89% sat in the PAR, 11%, which translated to roughly 62 million in that core allocation. And of that 62-ish million that was actually allocated, interestingly enough, about 70% of that went to mental health and substance use conditions. So the take-home message from this is comorbidities are recognized as important, obviously, but the demand was, and by extension, I would say still remains greater than the funding available. The next two slides are just graphic representations of some of the figures because I think it shows the power of this. You could see the PAR is represented in the purple and the core allocation in the green. And this next graph is the breakdown of the core allocation, that's 62 million by priority comorbidity group and specific comorbidity. And here you see the breakdown with increased attention to substance use conditions and mental health, then followed by hypertension and lastly, cervical cancer. And I'll share these slides with this group if there's interest after. So what's the risk of not investing in comorbidities, right? I'm a scientist. I always like the counterfactual. I'm going to use mental health as the illustrative example. So I've already talked about we've got this tighter fiscal environment. We've got increased pressures. So, like, what if we don't invest? In my world, coming from United for Global Mental Health, we really believe that mental health shouldn't be viewed as this additional cost or this additional program even, right? This is about mental health being a high impact strategy that protects core HIV and TB investments. And this is how we should be thinking about comorbidities, protecting our HIV and TB investments. So without addressing key mental health, the risk of not investing is treatment adherence declines, retention and care weakens, prevention uptake falls, program outcomes deteriorate, prior investments lose effectiveness, right? This is the risk of not investing, not listening to the country demand that we saw so strongly in this review. The way of framing these comorbidities that we saw in the GC7 review is it's really about helping to safeguard program performance and accelerating progress toward HIV and TB targets. Interestingly, from this review, we also got a sense of kind of what's already working. So the review revealed that countries are already starting to implement integration, and by integration specifically here, I mean integration of comorbidities into HIV and TB programming through a few different modalities. And this should look familiar to many of you. Co-located services, the good old one-stop shops, right? Through shared health workforce and training, through quote unquote integrated service packages. That language we found was used frequently, though vaguely defined, and through integrated referral systems and coordination mechanisms. So we know that integration's feasible And we saw that it was already happening in GC7. This was part of a more extensive qualitative analysis. I'm happy to share more details on that. But interestingly, what we didn't see, and I want to underscore this for GC8, integration must move beyond just thinking about integration into HIV and TB platforms, but into PHC systems. And this comes across in our recommendations in the report. PHC is the anchor for sustainability and scale. So, what can you do? And these are recommendations coming out of the report. So when we think about priorities and how we translate priorities into programs and positioning them in the country dialogue and in the funding request, number one, make sure that what we are advocating for and designing is aligned with the up-to-date normative guidance. And I specifically want to draw everyone's attention to the most recent HIV service delivery guidance, right? Which really talks about the HIV treatment platform as an opportunity to integrate diabetes care, hypertensive care, and mental health and substance use services. That's really critical. Number two, prioritize comorbidities in the core allocation and avoid pushing them to par. I know that that's tough, especially in this constrained environment, but there is an efficiency argument to be made, programmatic efficiency and a cost effectiveness and efficiency argument to be made. Number three, frame comorbidities as performance enablers. They are directly linked to HIV and TB outcomes. I know the mental health literature and evidence base best. Happy to take any questions on that. Number four, use existing service delivery platforms. This is all about integration. Yes, the low-hanging fruit becomes the quote-unquote add-on services to HIV and TB platforms, but as I mentioned before, sustainability and scale is about strengthening PHC. Number five, strengthen M&E frameworks. We only care about what we measure, huh? So we need to be thinking about including indicators for comorbidities across all areas. That's a strong recommendation coming out of this report. And invest in smart TA. There was a whole section of this report where we did a qualitative analysis of what the asks were in the funding requests for TA. It came across clearly needs in the area of policy, systems, implementation support. Interestingly, the actual ask, monetary ask in the funding requests was so minor compared to what the needs, the TA needs elaborated were. So there was this real imbalance. And then lastly, plan and articulate co-investment, right? It's not just on the shoulders of global funds to fund all comorbidities. That's just absurd to think so. But this is about partnership, both domestic resources and other external resources. Final takeaway, I'm going to get a little philosophical now, right? In GC8, the question is not whether to fund comorbidities, but really like how do we integrate them smartly to protect and maximize impact? We already know that countries are asking for this. We already know that models exist. We already know that the cost of inaction is high. Often we pit one thing against another, which I think is a very perverse way of thinking about this. Integration is not an integration of comorbidities. It's not a competition. It's not competing with HIV priorities. What we really need to think about is exploring how these comorbidities are sustained under the very real funding pressures. And ultimately, it's about ensuring this delivery of truly, remember I started with this, truly person centered care. So I will stop right there. I gave you the abbreviated version. I've got a 50-slide deck from this report, but I'll stop right there. And Katie, back to you.
Okay, thank you so much, Erin. I think we all appreciate the non-50 slide version at this stage, but if that 50 slide version is available for sharing, I do think that some might find it quite useful, and we would appreciate seeing that and being able to share it out as a resource.
Absolutely. I can share the slides. I can share the report. I've got a plethora of resources, and I'm delighted to share all of them.
Excellent, and excellent use of plethora this morning. So I was just trying to just quickly sort of define or contextualize PAR that
Great.
you mentioned a couple of times. So I've just pressed send on that. It's my simplified version of it. Kind of will tell me where I'm being too simplistic about it, or others will, but just wanted to put that there and a link to where you can find out more about it if it's something that hasn't hit your radar, because there are a lot of acronyms and definitions in Global Fund world, but this is an important one in the context of grant making and the process that countries are embarking on. So thank you very much, Erin. I think I appreciate that. I will open it up for any sort of Q&A or comments. So we'll invite people to put their hand up. One thing that I wondered from my perspective as we wait to see if others come in with questions, if you could talk a little bit about just kind of leaning on your larger sort of and longer expertise as well, is around sort of the issue of integration. And in terms of like resources that may be available in terms of in the absence of there being good integration guidance in the Global Fund context, where you might recommend colleagues go to sort of understand that, because as you were saying, integration is not just about integrating sort of comorbidities into sort of HIV or TB and malaria and Global Fund programming, but that broader sort of goal to integrate into broader sort of primary healthcare, which is, as far as at least I understand it, sort of the essence of what the Global Fund is talking about in terms of transitioning sort of its work into, integrating its work more writ large into that. And there's a lot of, I think, confusion and a lack of clarity as to what that means and how that impacts key populations and communities in particular, and community systems. So I'm just going to pause there, and I do see that we have one hand raised, so I'm going to invite them to come in with their intervention. Then we'll come back to you, Erin, and see for if there's any further questions. But Ashwini, if you could unmute and introduce yourself and go ahead with your question or comment. Thank you.
Hello, I'm Ashwini here. Are you able to hear me?
Yes, we can hear you clearly.
I am Zero Hunger Champion in United Nations World Food Program, and also working for International Telecommunication Union. Basically, for working on innovations in the sector of healthcare and TB and HIV and malaria in this particular GFAN context, are there any procedural mechanisms such as registration or any kind of documentation templates which are necessary for creation of a submission to this particular GC8?
So I think thanks, Ashwini. I think that's a broader question that maybe we can address in the chat. Erin, if you have any insight on that, go ahead. But I think we can address that question in the chat. And if you wanted to go ahead on the question that I posed, I'm just looking to see if there's any other hands raised. But yeah, over to you, Erin.
Sure. Ooh, integration. I love this topic. And you're right, it's messy. It's very, very messy. And I think part of that messiness comes from there's not a shared definition. And that's inherently problematic. Everyone defines it in their own way. I think the default often is people think of service delivery integration, right? Which is services being delivered at the same place and time, so point of care. But it's just not about services. It's about the integration of systems as well to support services. So integration needs to happen across many different levels. And I think that's very important to keep into consideration. I think also integration has been a journey. The starting point was this idea of add-on services at the beginning. So picking any type of platform, and then, gradually kind of adding more services onto it, whether it's the HIV service delivery platform and adding sexual and reproductive health services, adding family planning services, now adding NCD services. And there's many different examples of this add-on model. Then became like the one-stop shop model. The journey has evolved now when we talk about integration to this idea of, well, those platforms actually fragment the health system in a way that's not sustainable and end up weakening primary health care. Is there a way that we can bring services back to primary health care in a way that makes sense? So I think the point of where we are in this journey now is actually kind of dismantling what we have created, but that comes at a cost. And we can talk about that cost. It also comes with a need to strengthen the primary healthcare platform to be able to deliver said services, because we've spent many years ignoring PHC, and in many contexts, the maturity of the health system is not ready to deliver, the full package of services which we're asking it to do. In terms of resources that are available to help kind of implementers and other actors think through this, there are some really great case studies out there that have been documented about the so-called journey and different approaches countries have taken, whether some have gone for just strengthening their primary healthcare system first out of the gate. Others have taken this incremental kind of add-on approach, and then by extension afterwards strengthening PHC. The case studies have been developed by the Special Program for Primary Health Care out of WHO, and they have a whole learning center and repository, and I think that's a good place to start. So my mind immediately goes there. For the systems strengthening aspect, that's quite fragmented too, because each area of the health system has approached their own system strengthening. So you have the health workforce that has really worked on how you have approached that. You've got the lab system that has worked on their integration and strengthening. You have the whole HMIS that's worked on their system strengthening, but how you bring that together, I think that's where we've had some weaknesses.
Thank you. I do see one further hand raised. I'll give colleagues a moment to add any hands, but first go to Robin to introduce yourself and come in with your question and or comment, Robin, and I'll see if there's any other ones, and then we'll wrap up with you, Erin. Go ahead, Robin.
Great. Thanks so much, Katie. Thanks, Erin. My name's Robin Montgomery. I am beaming in from the traditional unceded territories of the Algonquin Anishinaabe Nations, what we now know as Ottawa, Canada. It's great to be here. I'm a member of the Developed Country NGO delegation and a global health consultant. And I just wanted to pick up, I don't mean to sideswipe the agenda today. So please feel free to say, you know what, we're going to discuss this in more detail at a GFAN call down the road. But I think, and Erin, I really appreciate your overview about integration. My fear is that from what I am seeing on the ground as a technical assistance provider to 9 countries during this process, is that integration is being understood as a means to absorb community and civil society services. When we know that integration doesn't necessarily need to be that way, right? If we are looking at the principle of doing no harm, that these things need to be really planned out very, very carefully, because if they are rushed, they will do harm. And no one wants that. And there are examples. We are working on one right now in Nigeria that shows that integration is actually really beneficial in terms of improved health outcomes for key populations like people who use drugs when services are integrated from primary healthcare into community settings. So just to flag that this can go both ways. It doesn't necessarily mean that community services, civil society services, need to be absorbed by primary healthcare. Thanks.
Thank you for being so explicit about that. I would absolutely agree. And the way I define primary healthcare, community service delivery is part of that. It's one of the tenets of PHC. There's primary care and then there's primary health care, and community sits within that PHC umbrella. We artificially, I think, somehow divide PHC and community. To me, that's a continuum of care, and an unnatural division. And integration should be happening at the community level too. And we should be strengthening the community service delivery model and thinking about how we can actually form bridges between the two. So Robin, you and I are like champions together on that front. And there are some incredible models of integrated community service delivery out there, 100%, both at facility level and community facility level, but by extension, non-traditional service delivery models leveraging community health workers and other kind of peer-led models that are delivering integrated services. Some really creative work happening and evidence-based.
Mm-hmm. Yeah. And just to flag, for those of us who were able to download the Global Fund materials before they were taken off, in the modular framework handbook, there is specific indication in the RSSH Health Human Resource section that expands the Global Fund's understanding and definition of community health worker so that it also includes peer workers and other lay professionals. So anyways, I'm sideswiping the conversation, but just wanted to flag that. Thanks.
Thanks, Robin, and thanks, Erin, for your thoughts on that. I do think we always well, you don't always sideswipe agendas, Robin, but we always welcome your.
I do. And I apologize for that.
I think that the bigger thing is in the absence of the guidance documents being published again, it has been challenging to figure out how to have a larger conversation about this and how to support both advocates and those who are trying to engage in what will be coming in terms of grant application processes around these issues, effectively. So I think it's always good to bring us back to it, Robin, and thank you for that. And I think we'll be looking forward to some more conversations around that as soon as those guidance documents are available. Or in the absence of them, there may be other things that need to be done. And I have to say, Erin, I wasn't personally aware of the WHO sort of learning sort of center that you had mentioned, and so that's something that I will look up because I've gathered a few different materials, but that wasn't sort of one that I had come across. So there may be some stuff there that we can share in terms of intermediate or initial sort of resources for colleagues on that resource page that I mentioned earlier around GC8 in the absence of specific guidance. at least in terms of, helping colleagues get a little prepared. So thank you very much and really appreciate it. Erin, really appreciate you and your colleagues as well, always reaching out and sharing the information and sort of the data that you are gathering. I think it would be very helpful if you're able to share the slides so that we can share them out with our colleagues and just keep us up to date and keep engaging with the conversation. And hopefully we'll see you back on some calls as we do get into more of the discussion around integration and how grant applications are shaping up. So thank you.
Great.
Erin.
I would love to. Thank you so much for having me today, and you'll see more of me.
Wonderful. Thank you so much. So I am gonna, because we did do one of those, let's do 14 different things on our call this week. So we are going to transition into sort of the remaining element of our agenda today, which is that we wanted to come back to the sort of the US government memorandums of understanding and some of our sort of work in recent weeks, days really, around that, and share with you some of those sort of findings. So I'm going to pass it over to Conte to start us off on that discussion, and then we'll open it up for Q&A as well once we've shared a bit of information from our side. So Conte, over to you.
Thanks a lot, Katie. And so I'll be quite quick, and I'm mostly just sharing information from third parties. So just this is not like, this is thanks to other people who know better what they're talking about. The reason why we wanted to bring attention back to the MOUs is that they really are key factors in any planning discussions, whether like in countries where they exist. Where their money is going to flow and how it's going to flow there is really important in the next few years in terms of any health intervention, really. The problem is that this is still extremely opaque. And there's a typo there, sorry. The exception being a handful of these MOUs that were actually published. But even then, the level of detail provided by the actual document is so low that it's close to useless. So how to follow the developments around the MOUs? And again, the issue is that this is information that we need for GC8 planning, but it should be available now and it's not. But information becomes available first and foremost for civil society members on the change calls that are taking place every Thursday. If you don't know what the change calls are, do reach out to us, and we'll be very happy to put you in touch with the organizers. Since December last year, Partners in Health is also organizing weekly calls. These are on Wednesdays, and they specifically discuss the MOUs. And again, they have very good access and a lot of smart people working on understanding those MOUs. And so I strongly recommend getting onto those. There's Emily Bass's Substack. Emily Bass, friend of the show, as we say. She also has very good access to information, so a lot of information coming out. First is published on a Substack. It's free, so do go in. And I've shared in the chat the latest round of analysis that was shared by colleagues in Partners in Health. And some of the things that I wanted to point out of that analysis, and I recommend going into the documents, pretty short. But regarding planning for GC8, the first thing to look at is that if you look at top line numbers for those US MOUs, they're typically annualized. So they'll tell you like this would be this many millions per year in country X, Y, or Z. But the way the money will actually be disbursed, looking at what we know from the press releases, etc., a lot of the money will be front-loaded. So in fact, the drop in funding is quite sharp after the first or second year of implementation. So a country might have just a 10% drop in funding compared to previous plans of the US. The first years, 2026 to 2027, and then it goes down to like a 40% drop 2 years down the line. So that's the first thing. These are front-loaded. So in terms of planning, that has like a lot of consequences that we need to think about. The other one is that there are truly gigantic co-financing requirements that are included in a number of these MOUs. They vary country to country, but some of them are extremely ambitious, not to say just wild. Some of the countries that have made like close, I would say, like close to irresponsible commitments are Nigeria, Malawi, Cameroon, and essentially they've committed to invest as co-financing in those MOUs more than was projected, they would increase their health budgets for the next few years. So what those targets mean, and that it depends country to country. For a number of countries, the targets are largely reasonable, or at least appear to be. But that means either that the requirements will be met, and that means that they will make any additional co-funding requirement extremely challenging to meet, and they also mean that these countries, essentially any additional investment in health for the next few years is going to be guided by US priorities, because almost like a majority of it is likely to go to US co-financing requirement. The other possibility is that these targets that are completely unrealistic will be used by the US as an excuse to renegotiate or cut funding. And the language is already in the MOUs we've seen to say that that can happen if the targets aren't met. Another thing to flag is that KPs and key and vulnerable populations broadly are just gone from the language of these MOUs. So that's what that means in terms of implementation isn't clear. That doesn't mean that there would be no programming targeting these populations, but it is a real risk, and there's really a lack of visibility there. So that does mean that in terms of planning, which really should be a strong push, and I'm preaching to the choir here, for more of these key and vulnerable population interventions to be loaded onto Global Fund grant aid, because we know that a number of them are likely to be dropped from US funding. We know that the HIV programs are cut less than TB and malaria programs. There's a bit of a double hit for TB as well, because nutrition as well as family planning has been completely dropped from US funding, according to the MOUs we have access to. And so that means that it's going to be particularly hard for TB, because we know a strong link between nutrition and TB. So these are some of the things I wanted to flag out of that analysis I shared in the chat, and I really recommend anyone involved in any sort of discussions to really keep an eye on these different spaces, and specifically that those analysis. Some of the I think so. We shared last week a link to a short survey around your priorities and concerns around the MOU. We really thank all of you that took the time to fill them. We got over 50 replies in less than a week, so it was really helpful. We're still working on the analysis, but we really see the same concerns in all countries regarding the lack of transparency and the challenges that creates in terms of planning, and the risk of duplicating programs with other funders, including Global Fund, and just a general loss of impact and lower efficiency. But we also heard asks around the need for more information, for more ways of coordinating across civil society, and we're strongly recommending that like the partner in health calls, they really are the space for that access to information and coordination. We on our end will be working on more tailored resources to support specifically Global Fund planning, with the idea of more directly linking the information that is provided by partners around the content of these MOUs and the overall process, and the specific Global Fund information that we are actually good at, know something about. One thing, the three sort of out of the level of analysis we have access to now, I think some three key asks would be that MOU discussions and GC8 plannings are taking place in parallel, and there really should be a push out of CCMs to be involved across the two processes, not just GC8 planning. There's a lot of countries where this is probably not realistic, but I believe is something that should be happening, and that should be flagged early on. There's a need to build more resilience into Global Fund planning. One of the challenges that, as I said, the funding out of these MOUs is not reliable, which means that if any programs are being built on top of US funding, there's a risk that the funding is pulled because, for example, the co-financing requirements haven't been met, or because it turns out the money those programs were funded via co-financing requirements, and that co-financing was unrealistic. It does not happen. So there's a need to avoid a 2025 scenario where programs across the board are being stopped because the US have stopped their programs. But the problem is that there will be a tension between that and impact and value for money. If you build in resilience, that means that you're being less efficient with the money you do have. And finally, you need to scale up KVP programming compared to GC7 to compensate for likely cuts from the US government. Obviously, this is quite unrealistic, but it is not the case that needs to be made at the CCM level. That's the end for me, Katie.
That's it. It's solved. We know what's happening. We know how to solve. So just that. Just to recap, just the link. I've shared it in the chat to that survey that we're doing, that sort of rapid assessment survey, which we still welcome colleagues to input into, which helps us gather information where you have it, because not every question is sort of a required answer, if that makes sense. So you only have to answer where you have something that you can share, but also helps us figure out what your needs are in terms of these sort of MOUs, and understanding what the needs are from our colleagues for advocacy and for your work. So if you haven't had a chance to do that, Conte just shared some things that we're learning through it as an overall, but it is still open and you can still fill out that survey. And with the recommendation around joining, in particular, those partners and health calls that are taking place regularly and have been, where a lot of information is shared. If you're able to prioritize those, we do attend from our team as well in different cases. So opening it up to the room for any sort of questions or I guess interventions based on what was shared in terms of what we're finding and the information from that survey. Any questions or comments? Ashwini, go ahead.
Basically, following up on the procedural mechanisms which we earlier discussed, the country coordinating mechanisms is a feature for going ahead with the coordination mechanisms for submitting the application. Is there a platform channel for getting the information of the contacts, emails, or address or phone number or any kind of contact information of the country coordinating mechanisms would be a great help. Any input on that?
Yeah, you can find that on the resource page link that I shared, the GFAN resource page. We do have a link to those CCMs that we have contact information for, and Conte is just putting up this page again, but it's on that repository, the key resources for Grant Cycle 8, and I shared the direct link to that in the chat for our resource page. Okay. And you can find that information there where we have it. You're welcome.
Yeah, thank you so much. Great to hear from you. Thank you.
Any other questions or comments? I am not seeing any. Sorry, I'm just double checking the chat. Okay. Any other questions or comments from colleagues? It's a quiet group today, but it's March. I don't know. Feels, at least where I am, it's not the brightest of days yet, although a little brighter than a few weeks ago, because of course we changed our clocks here in North America. But I'm not seeing any other hands with questions or comments. So I think, Conte, I'm just looking to you to see if there's any other announcements from you or the team. Nope, I'm not seeing any. So without any further questions or comments or announcements on our side, just say thank you to everyone. And I hope you enjoy the rest of your day, and we will continue to share information on all of these. And I spoke too soon. I see a hand raised from Priyanka. So Priyanka, I'll pass it over to you, and then you can wrap up the call after your share. Thanks.
Thanks, Katie. Just to quickly come in and share that I will drop the link in the chat immediately after I'm done talking. So hang in there for the link. But there is a new report that has been circulated by friends and a few other partners, and it might be an interesting read specifically because it talks about the intersection of the fight against malaria and how it features within the America First agenda of the current government. And it might be a useful and interesting resource for advocates to look at, because in the light of the constrained landscape that we are looking at, there might still be hope and probably chance to use or opportunity to use this as a lever in terms of being able to get more resources for malaria programs within the country. So I'm just going to quickly pull up the link and drop it in the chat box. And that's all from me. Thank you so much, everyone, for joining the call. As we said, the rapid assessment remains open, and the GC8 resource page is a living resource. We will continue to update it as we get more information from you. And you can write to any one of us to get any resources that you have published on there. Thank you so much.
Thank you, everyone. Have a good rest of your days.
Bye.
Danke.
Thank
Bye-bye.
you.